This is Women's Health Week, and it's a chance to unravel some long-held myths and fascinating facts to celebrate the strength of women and improve their resilience. CCA Health California is a healthcare services organization that supports older adults and individuals with the most significant needs in Santa Clara, San Joaquin, Merced, and Stanislaus counties. Joining us today is Dr. Laura Clapper, Medical Director for CCA Health California. Welcome, Dr. Clapper.
Great. Thank you, Desiree.
Yes, happy to have you on. Like as mentioned, it's Women's Health Week. So let's start by discussing some common facts we hear about women's health. This one I hear all the time: women live longer than men. Is there any truth to that?
That is definitely true. That women tend to live longer, about 6 years longer than men in the US. Partly because they visit the doctor more, they take better care of themselves, and they also maintain social connections throughout their life. But as women live longer, they tend to have issues with mobility. So, and that can impact them in terms of even just living independently, preparing meals, doing other kinds of, even getting out of bed. So as we get older, women, and this can impact our safety, independence, and quality of life. One way to reduce these risk factors is prioritizing mobility and starting with a 10-minute walk every day to improve your health over time.
I like that. And a 10-minute walk sounds simple enough to do. It's something we can include in our days. What part do social connections play when it comes to mental health conditions, doctor?
So women are more at risk for both depression and anxiety. And if you've lost your spouse, if you've never married, if your children have moved away, you're going to be at risk for isolation. And so maintaining your friendships and your community is really important. At CCA Health of California, we really think that this community connection is a very important part of aging well. We're starting a buddy line that connects trained volunteers with our Medicare members to offer companionship for those who need it most.
I like that. I like that there's a buddy line. Are there any other conditions that impact women more than men that we should know about?
Yes, definitely. Due to menopause, women are more at risk for osteoporosis. The osteoporosis affects women 4 times more than it affects men. And the osteoporosis is having weak bones. Osteoporosis can lead to bone fractures, loss of height, and even reduced mobility. It's important to talk to your doctor about your specific risks, and all women over 65 need to get a bone density test or a DEXA scan.
Good to know.
Bladder issues are also, I was
Go
just going to
ahead.
add that
Yes.
bladder issues are another issue that impacts women more than men. It's linked to menopause, and women are 2 times more likely to be impacted as men. Unfortunately, it's one of those issues that we don't want to talk about. It can be embarrassing, but there are treatment. And so please talk to your doctor because you don't have to live with it.
Yeah, we need to have those conversations. And I've heard that women are at higher risk for heart disease as well. Is that true?
It is true. Unfortunately, although it can be a little tricky, heart disease is the #1 cause of death for both men and women, but women are in a way more at risk because those symptoms you see on TV that are like chest pain radiating down the arm, those are very typical for men. Women can have those symptoms, but they also get other symptoms like shortness of breath, nausea, vomiting, back and jaw pain. So it's really important to take those symptoms seriously and get the care and go get care as soon as possible.
Yeah, it sounds like it's important not to ignore any conditions that we may have. And beyond medical conditions, doctor, what else can impact women's health as we age?
Not having a financial safety net, it's nice that you've talked about credit and financials on this show because that can be a big issue for women as they age. If you're on a fixed income, you're struggling to pay for groceries or rent, that creates a lot of stress that can have a big impact on your life. Even lacking transportation to medical appointments or the grocery store can have an impact. At CCA Health of California, we know that we need to take a holistic view on helping you have the best health. And that includes physical, mental health, as well as social service needs.
All right. It looks like as we have those financial goals for ourselves, we also need to have those long-term health goals as well. Doctor, thank you so much for telling us all about this information just in time for Women's Health Week. You can find out more by going to ccahealthca.org/health.